Hello, my name is Alfonso Cruz Gentoft. I'm a geriatrician from Madrid, Spain, and a member of the academic board of EUGMS. And I've been asked by Nestlé Nutrition to chair this important symposium on MCI, mild cognitive impairment, and its links with nutrition, including new advances in science in this area. To briefly introduce the topic, I have to go back to many years ago. All the geriatricians will remember when the concepts of memory loss and dementia were linked with old age. So the usual term was senile dementia, something you had to have if you were an old person. And at that time, there was also the finding and the observation that some people had some memory loss, but they functioned well and never had dementia. And there were very many terms for that. Probably the most used were age-associated memory loss or benign senescent forgetfulness. Something to name, this is old people having the crazy turns and things. Science evolved, and at some time people noticed that Alzheimer's disease and senile dementia were very close, and the term of senile dementia of Alzheimer's type appeared, and later it was agreed that it was part of the same disease that was described in younger people, and that was called late onset Alzheimer's disease. Research evolved, and at this time we have very many different types of dementia that we can characterize quite well clinically and also pathologically. The most frequent is Alzheimer's disease. In non-age-generians, it's vascular dementia, many other that you will probably know. And also the term of age-associated memory loss evolved, and a new term appeared mostly in the science of neurology that was called mild cognitive impairment. As you will see later, it was defined by persons who had very low performance in cognitive tests, but they still functioned well. In fact, there was quite a discussion in neurology and people expert in Alzheimer's disease mostly, trying to distinguish the mild cognitive impairment as something different than prodromal dementia. That means times before you can see the clinical dementia, but where you can find some symptoms that are already present. And now we're going to biomarkers before you have absolutely any symptoms. And this kind of graphs you're familiar with distinguish normal cognition, dementia, and there's a time in between that is confused with healthy aging. And this part is called MCI. It's important because detection of MCI has the potential to reduce or retard the appearance of dementia. And science has been studying longitudinally patients with MCI, which are usually not extreme old age, but mostly middle age or early older people. And it's shown that a couple of them, perhaps 1 every 5, revert to normal cognition. Many of them have stable MCI for long periods, and at least 1/3 would progress to Alzheimer's disease or dementia. There are several types, you will see that later. Some who revert to normal cognition at that time, sometime in the future, will have again MCI. So this is not a stable situation, at least for some people it's not. If you see and remember that graph on the first slide, and you see this slide that talks about frailty, including cognitive frailty, you see they are very close. The concept of cognitive frailty has come into geriatrics, and there's a link between cognitive frailty and physical frailty that are very relevant because they seem to share pathophysiologic pathways. In fact, if you define frailty as the weakening of health or a lack of resilience, you can see that health has at least 3 major columns, which is the physical one, mental, and social. Social is a bit late yet in literature, but mental frailty is called, or cognitive frailty is very close to the concept of mild cognitive impairment. If you go to management of frailty, and you see this is a recent review in Lancet, and you look at the evidence, there's no drugs, and most of the evidence on management of frailty is based on physical activity or physical exercise, and occasionally on the use of nutrition intervention. This is very common for geriatric syndromes, where you have usually no or very few drugs, but you have to start with non-drug therapies. And if you look at recent guidelines on management of MCI and you look at the evidence, again, the evidence for drugs is very poor, but exercise has evidence, not cognitive interventions, by the way. If you read them, patients diagnosed with MCI may benefit from regular exercise, but at this time, there are no pharmacological or dietary agents that have shown to have symptomatic benefit in MCI. So there seems to be a lack here, a need of more science to know what's happening and how to intervene here. We as geriatricians are used to use non-pharmacological therapies. We used to include in any treatment plan, in any management plan, nutrition, exercise, physical activity, and other kinds of therapies like psychotherapy or physical therapy. This is how all guidelines start, by the way, for most diseases, but most physicians, at least organ-centered specialists, usually don't read this first part of the guideline and go directly to drugs. This we cannot do. We have to start with the basic, which is not pharmacological therapies. So the importance of this symposium, online symposium, is that we will start through a condition that's relevant for older people, which is mild cognitive impairment, as a window to preventing or to retarding dementia or dementing dependence. The speaker here will be a very well-known geriatrician for most of you, who's Professor Colin Sieber from Germany and Switzerland at present. He will review what's mild cognitive impairment and what's the modern concept of this condition. Later, we'll have the opportunity to listen to Professor Russell Schwellow from USA, and he will go to more basic science. What's the effect of ketones on brain metabolism? Because this basic science is where nutrition and dietary sciences are based if they want to be effective. Finally, we listen to Professor Stephen Kuhnen, based in Sherbrooke in Canada, and he will show what is the effect of an oral nutritional supplement in mild cognitive impairment, both in the basic part, brain energetics, and in cognition, hopefully in the future also in physical functioning and retarding disability. At the end of these three excellent talks, we'll have some time for questions and answers with the three experts. I do hope you will enjoy this symposium within the UGMS Online Congress. As I told you, it's sponsored by Nestlé Health Science and Nestlé Nutrition Institute. Thank you for following us.